We need to be paying attention to what's going on in childhood, how kids are being treated and what they're being exposed to. It actually has long-term implications. And so if we're interested in preventing heart disease and preventing cancer and preventing obesity, all of these things that cost us astronomical amounts of money, that impact the quality of people's lives, they have roots in childhood. My main area of focus is medical sociology. A lot of my research has to do with examining the effects of stressful childhood experiences on child mental health. Working with colleagues on an NIH-funded project, we're finding that major life traumas, childhood maltreatment, child abuse, impacts your health in later life. Not just things like depression and anxiety, but also heart disease, obesity, cancer. And some of this is through different kinds of health behaviors. So kids who are maltreated are more likely to smoke, and then smoking is associated with heart disease. Some of it's through epigenetic changes, but we're never going to solve these problems. We're never going to really kind of get to the bottom of dealing with something like obesity unless we're taking into account people's social position in society, coping mechanisms, relationships, religious experiences, all kinds of different things that kind of may transmit experiences in childhood to your health in later life. I think it's more exciting than anything I've ever done before. Looking at these childhood conditions brings more attention on more people's radar. People interested in heart disease and people interested in cancer and people interested in obesity can now look at something like maltreatment in childhood and put some of their efforts into that, which then, may increase the possibilities for intervention. When the Iraq and Afghanistan conflicts kind of kept going, I became interested in wanting to study the effects of these multiple military deployments on child mental health. Colleagues and I were able to get funding from the Department of Defense to do a study. We were mostly looking at younger kids. They were actually very resilient to the ups and downs of military life. The biggest thing that we found so far is that parent mental health has a big impact on child mental health. And so rather than it being anything about the deployment experience or the separation experience itself, it's really about how mom and dad are doing. We're hoping with the information that we produce that it will help the military tailor services better to meet families' needs. My projects tend to be big data, big studies, and so there's actually a lot of different places where graduate students can fit into that. A lot of the techniques we use, particularly in the kind of work I do that's longitudinal, are more specialized than what they're going to get in the classroom. And so it's a great opportunity to be able to learn that as a graduate student. I love this institution's sense of mission. I love this idea in Catholic social teaching of protecting the vulnerable. Children are some of the most vulnerable members of society. Wanting to kind of keep that at the forefront of what I do and what I focus on in terms of my research is really important to me.